that's the clavicle, and all I want you to know is that it is the clavicle. We're not going to do parts of it or anything like that. Okay, just for your own information, realize that the rounded end does go to the sternum, so that it's going to sit in here, going to the sternum, and the flat end is going to go to the acromial process of the scapula. Okay, I will not ask you if this is a right or a left bone on any of them. I'm not expecting you to know that. I think intuitively you will eventually know it, because if you know the parts, you'll be able to figure it out, but I don't ask that. So, clavicle. This is your scapula. Okay, and basically, this is it's actually a right scapula. Okay, which, like I said, I'm not going to ask you. So this is most likely a right clavicle, because they tried to put the same size in the boxes. So when you actually look through the skeleton, and I brought in the skeleton there, the whole thing, so you can look at that. When you actually look through it, the anterior surface, okay, this is your subscapular fossa. Okay, sometimes people call it the body of the scapula, but this is actually the indentation and everything is the subscapular fossa. Okay, and basically, one of the reasons we're going over these parts is we're going to see a little later that a lot of the muscles that you're responsible for are going to sit in these locations. Okay, so the subscapularis muscle is going to sit in this subscapular fossa, okay, over here. Okay, and it's actually one of the rotator cuff muscles, the subscapularis. So that's the anterior surface of the bone. The posterior surface always has the spine of the scapula, which is this, okay, and the acromial process goes into the spine of the scapula posteriorly. Okay, and the spine here is going to divide the bone up into the supraspinous fossa and the infraspinous fossa. Okay, supraspinatus will sit here. Infraspinatus, teres minor, and major usually will sit in here in the infraspinous fossa. Okay, so supraspinous fossa, infraspinous fossa. Okay, and the supraspinatus is the rotator cuff. The teres major and infraspinatus are rotator cuff muscles. I think I mentioned it the last time. They hold this very shallow sort of articulation. This is the glenoid cavity or the glenoid fossa, which is where your humeral head will sit. So you get a very shallow sort of cup there to hold the head of the humerus in place. Easy to dislocate, like I think I probably told you last time. If you ever watched Mel Gibson in Lethal Weapon 1, he was constantly dislocating his shoulder and then knocking it up against the wall to get it back in place. Rotator cuff issues are usually going to be pitchers in baseball have issues with it because they end up throwing out and tearing the rotator cuff muscles. So glenoid fossa, okay, and that always has to be lateral, okay, because that's how the arm is going to hang off. So this is your lateral border, and this is the medial border of the scapula. Okay, this is the coracoid process, and the coracoid process goes into the glenoid fossa. The acromion goes into the spine, okay? And that's the scapula. You can write that down. So here's a humerus. This always has to be posterior. Okay. This is your olecranon fossa. That's where your elbow is going to sit. And this is the olecranon or olecranon process on the ulnar, and that's what makes up your elbow, the gliding joint to the elbow here. Okay. So this is the olecranon fossa of the humerus and the olecranon or olecranon process of the ulna. So this is the posterior aspect of the humerus. Okay, this is the medial aspect. Okay, the head is always medial because it has to be close to the body. It's going to sit like that in the glenoid fossa or glenoid cavity of the scapula here. Okay, that's how it's going to sit. So this is the head of the humerus, and then we have the greater tubercle. Tubercle is just a bump on a bone. You saw a lot of this. So processes is an extension off the bone on the skull. Okay, now you're going to see processes like the mastoid process in the skull and the styloid process Now you're seeing tubercles and trochanters, things that are bigger. Okay? Greater tubercle, lesser tubercle. I'm not only responsible for the intertubercular groove, but that's what that is. And if you follow it down, this bump over here is the deltoid tuberosity. Okay, deltoid tuberosity is for the attachment of the deltoid muscle, which gives the rounded appearance to the shoulder. Okay? This guy here, okay, is all superficial muscles. This is our John Travolta model. Okay, this is the deltoid here. It gives a rounded appearance to the shoulder. So this here, where it's attaching or inserting, okay, we'll talk a little bit more about muscle later. That would be the deltoid tuberosity if you actually got to the bone. Okay, but again, these are all superficial muscles. The other muscles come as superficial and as deep muscles. These are all superficial. So that would be the deltoid tuberosity. And then if you follow it down to the distal end of the bone, this is the proximal end of the bone, it's always closer to the attachment to the body. This is, the head is on the medial side, so this has to be the medial epicondyle. Okay, now when you look at these long bones, you have condyles and epicondyles. Okay, it just so happens to be in the humerus, the condylar processes here were actually given names. So this is the medial epicondyle. This here is the trochlea, and this is the capitulum, the rounded ball here. And then this is the lateral epicondyle on this side. Okay. So the medial epicondyle goes into the condyle here, but in this case it's called the trochlea. And the lateral epicondyle goes into the capitulum. This is your carotenoid fossa, right above the trochlea. And this is the radial fossa, right above the capitulum. And this here is the carotenoid process. Okay, the way this is going to ride, you got the olecranon process and the olecranon fossa. And the carotenoid process here is going to ride up into the carotenoid fossa. Okay. The carotenoid process here, when the elbow is bent, it rides up into the carotenoid fossa. I said a gliding joint before, I apologize. This is a hinge joint. The elbow is a hinge joint. Okay? So your elbow is really the olecranon fossa, and on the sort of anterior side, your carotenoid process and the carotenoid fossa riding on the trochlea here. Okay? The lateral bone of the forearm is, of course, the radius. Okay? The radius, and the head of the radius is here. The head of the radius, and it will ride on the ball here on the capitulum, and it will ride into the radial process, the radial fossa here. Okay? The radial fossa. So the carotenoid process, the ulna goes into the carotenoid fossa, the head of the radius rides on the capitulum into the radial fossa.
So
And that's the humerus.
The funny bone is?
Well, the funny bone is going to be basically over here, the olecranon process of the ulna, which makes up your elbow going to the olecranon fossa or the humerus. The only other thing on the ulnar that I want you to know is that, of course, this is actually the head of the radius. The head of the ulnar is at its distal end, whereas the head of the radius is its proximal end. Okay, and this little pointy thing here is the styloid process of the ulnar. Okay, and on the radius, you have the head of the radius, the little disc. You have the radial tuberosity here, and the styloid process of the radius. So you have styloid processes on three bones: temporal bone of the skull, the radius, and the ulnar. Styloid processes. These are the bones of the forearm. Ulnar is medial, lateral is the radius. Just think about when you do a radial pulse. You're using the radial artery, your two fingers over the radial artery to get your pulse. Okay, that's the lateral side, the radius. And then you have your hand and your fingers. And the way that you can tell is basically the way the curvature of the hand is. Okay, this is a right arm, a right hand. Okay, this is the radius. Okay, this is the ulnar. Okay. Radius. Ulnar. Okay. So, starting from lateral, your carpals are your wrist bones, scaphoid, and they're usually named for their shape. Scaphoid, lunate, right, triquetrum, and the little P-shaped one is pisiform. Okay, trapezium, trapezoid, capitate, and the little handle, the hamate, like a hammer. Okay, 2 rows of 4. Scaphoid, lunate, triquetrum, and pisiform. Okay, trapezium and trapezoid, capitate, and hamate. Some lovers try positions that they can't handle. Okay, and then this is the thumb side, or the pollex, pollicis, pollex is thumb. And the reason I know that is it's got 2 phalanges as opposed to all the others that have 3. So the metacarpals start with the big thumb, and it's 1, 2, 3, 4, 5. Okay, first, second, third, fourth, fifth metacarpal. Okay, and then the thumb, the pollex only has a proximal and a distal phalanx. Okay, all the others have proximal, middle, and distal phalanges. That's the upper extremity. Okay, its attachment to the axial skeleton is through the sternum, okay, through the clavicle. Okay, your shoulder girdle or pectoral girdle is the clavicle and the scapula. Going to the lower part of the body, you have your pelvic girdle. Your pelvic girdle. Okay? And the pelvic girdle is basically your os coxae, your 2 hips here, okay, and the sacrum. Your axial attachment is to the sacrum. Now, this here in the front is the pubic symphysis. Have you done joints in lecture yet? It's a slightly movable joint. It's an amphiarthrotic joint. Okay. It's a cartilaginous joint. It's got the cartilage pad there. Okay. And the reason it's got to be movable, or slightly movable, not completely movable, is because of the birthing process. Okay. If the bone was not movable, it would be much more difficult to give birth. Okay. This is a female. Okay. It looks like the pubic angle there is greater than 90 degrees. Okay. Less than 90 degrees, it would be male. Greater than 90, greater than 100, certainly female. Okay. And the angle would be the 2 pubic bones coming together, part of the ischium as well. Okay, with the pubic symphysis. This in here, the opening, you put your fist in there. That's the pelvic brim. Okay, that's the pelvic brim. It's the opening of the entire pelvic area, the pelvis. And of course your sacroiliac joint back here. Okay, so your sacrum and is your axial attachment. Sacrum and the hips, the os coxae, make up the pelvic girdle. Now, in your box, you have a hip. Okay, you have a hip. Okay, and usually you're going to look at hips from a sort of lateral and medial point of view. Interesting that other bones, I believe, were right bones. This one is actually a left hip because it has to sort of sit like this. This would be where the cartilage would go. This is your pubic symphysis would be here. Okay, this is the pubic bone. Okay, this is the ilium. This is the iliac crest, which sometimes you could probably feel it on your own body, the iliac crest. Okay, this is the auricular or articular surface for the sacrum. Okay, the roughened edge here is where the sacrum would go, sacroiliac joint. Okay, this here is your greater sciatic notch. Okay, now there's all sorts of structures on the hip. Okay, I'm making it simple, we're looking at the big structures. Okay, iliac crest, okay, iliac fossa, greater sciatic notch, the auricular surface, obturator foramen. It's like probably the second biggest other than the foramen magnum in the skull. Obturator foramen, okay. The hip is made up of 3 separate bones that are fused. The ilium, the pubic bone, and the ischium. Okay. This is your ischial tuberosity. That's what you sit on. Okay. Ischial tuberosity here, this bump. So this is the ischium, this is the pubic bone, and the top here is the ilium. Okay. This cup here is the acetabulum. Okay. The acetabulum is where the 3 come together, where the 3 bones fuse, the ischium, the ilium, and the pubic bone. Acetabulum is where the head of the femur is going to go. No one gets this wrong on the test. This is the largest long bone and largest bone in the body. This is the femur. Okay. Well, this hip is inappropriate for this particular set of bones because this is the posterior aspect. It should be sitting like this. But this has to be a left hip because the femur has to go there, and this has to be in the front. So, anyway. So, again, you have it, let's see, pelvic girdle. You have the os coxae, the coxal bones, 3 bones, the ilium, the ischium, the pubis, your iliac crest and fossa, the ischial tuberosity, the obturator foramen, the acetabulum, the articular or auricular surface with the sacrum, okay, your greater sciatic notch, okay, and on the other I showed you the pelvic brim and the pelvic angle, and of course the whole pelvic girdle has to include the sacrum. That's the head. There are all sorts of crests and ridges and all sorts of other things. I'm not holding your spines, and I'm not holding you responsible for it. Femur. Okay. Head of the femur that goes into the acetabulum. Just so you know, this little dot here, indentation is known as the fovea capitis. You don't have to remember that. It's where the ligament would attach from here into the acetabulum, sort of stabilize the hip. Okay. When they do a hip replacement, basically they'll usually do some kind of replacement of the femoral head. Okay, put some kind of artificial, maybe titanium cup into the femur, into the hip, okay, and sort of restructure the whole hip. Okay, equivalent to the lesser and greater tubercle on the humerus, you have the greater and the lesser trochanter. Femur is much bigger than the humerus, so your processes are bigger. Greater and lesser trochanter. Okay, on the posterior aspect, you have the linear aspera. Okay, your gluteal tuberosity is going to be somewhere in here. Okay, and then you have your medial and lateral condyle. Lateral and medial condyle. Medial and lateral. This has to go medial. Medial and lateral condyle. And on the sides, of course, your epicondyles we're not going to worry about. And then you, on the posterior surface, you have your intercondylar fossa. The head, the greater and lesser trochanter, the linear aspera, intercondylar fossa, lateral and medial condyles. Shin bone, tibia, tibia. Okay. I don't want to hear fibular and tibula. It's wrong. Not a spelling error, it's wrong. Tibia. Fibula. Okay. Fibula is the lateral bone of the leg. Tibia is the medial bone. the shin bone. So, how does this work? Well, this is, I believe, looks like it's matching. Your intercondylar fossa here, eminence, goes into the intercondylar fossa and forms the knee. This is your tibial tuberosity. So this is your knee. Okay. The medial condyle, lateral condyle will articulate with the medial and the lateral condyle of the tibia. What's this?
Patella?
That's your kneecap, the patella. Your knee is the femur, kneecap or the patella, and the tibia. Fibula is lateral, it does not articulate and does not play into the knee. Knee is the femur, and the tibia, and the patella. Okay? Basically, the fibula is going to attach the posterior aspect of the bone here. Okay? Now, on the medial side of the tibia, you have the medial malleolus, okay? And on the fibula, you have the lateral malleolus. So it's going to sit something like that. And this attaches posteriorly so that it doesn't really play into the knee. Okay, the rounded end is sort of the part that goes to the tibia up here. Okay, sort of the arrow-headed shape is your lateral malleolus. Okay. Now the two malleoli, are going to sit on either side Wow. Anyway, this should ride on the medial side of the talus, and this should ride on the lateral side of the talus. Okay, basically, the two malleoli are going to sit on either side of this tarsal bone. Okay, basically, this is your talus, okay, and this should technically ride on the talus like that, with the medial malleolus being on the medial side. The reason I know that this is the medial side is because this is the great toe. In anatomical position, the thumb is lateral. Okay, in anatomical position, the great toe, the big toe is medial. Hallux, thumb, pollex. Okay, so the medial and the lateral malleoli sit on either side and articulate with the talus. The tarsal bone of the ankle that rides up. The heel bone is the biggest one, is the calcaneus. This is your calcaneus. Okay? And that sits on top. Now, this is your navicular. This is the cuboid. And then you have your three cuneiforms, medial, intermediate, and lateral. This is your little toe, so that's lateral. This is the hallux or big toe, great toe is medial. So this is the first, a medial cuneiform, intermediate or second, lateral or third cuneiform, cuboid, navicular. Okay. Again, the metatarsals, just like the metacarpals, start with the big toe, and the hand, of course, it starts with the thumb, first, second, third, fourth, and fifth metatarsal. Okay, and then the phalanges are the same as in the hand. You've got the thumb or the great toe with a proximal and a distal. All the others have three, proximal, middle, and distal phalanges. Phalanx is singular. Phalanges is plural. Okay? Questions? All the parts of the bones are on the handout that I gave you. Okay? Anyone that came in late, there are 4 handouts out there. Some of them are repeats, but they're better copies of the ones you had the last time.